A very good evening to my dear readers, followers of Transformative Today. Tuning in today on a wonderful day and quite an important day, World Stroke Day 2020. What is stroke? Stroke can happen anytime, to anyone, anywhere. How to take care of it? What are the symptoms? What are the challenges? These are the questions which usually come to our minds as readers, as public. But who am I to tell you about stroke when we have such an eminent, power packed panel this evening with Transformative Today? And let me, without wasting time, quickly introduce my eminent panelists to my dear readers of Transformative. We have Dr. Prashant Makhija today, consultant neurologist, Wockhardt Hospital, Mumbai. We have Dr. Neeraj Sharma, consultant neurosurgeon, Heritage IMS Hospital, Varanasi. And we have on behalf of Dr. Shirish Hastak, who is the Regional Director, Neurology Department of Global Hospital, we have Dr. Naman Shah, Consultant Neurologist from Global Hospital, Mumbai. Welcome you all, my eminent doctors, for this wonderful panel today on World Stroke Day 2020. Before I go further, now there is one quick question जो आई थिंक जो आज अभी रीडर देख रहा है, जो फॉलोअर्स देख रहे हैं ट्रांसफॉर्मेटिव का लाइव, एक क्वेश्चन जो उनके माइंड में आता है, स्ट्रोक क्या चीज है? व्हाट इज स्ट्रोक? देयर इज अ लॉट ऑफ कंफ्यूजन. पीपल don't have a clear idea about what stroke is. Over to you, Dr. Prashant Makhija, if you can simplify it and demystify the confusion around stroke. Over to you, Dr. Makhija.
Thank you, Dr. Supriya, for inviting me to this wonderful panel. So, stroke is basically a disorder of the brain wherein there is disruption of blood supply to the brain. So, this disruption can happen in two forms. One is if there is a clot which is interrupting the blood supply to the brain, that is what we call as ischemic stroke, and it accounts for majority of the cases, roughly about 85%. In rest 15% of the cases, the disruption in blood supply is because of the rupture of the blood vessel which is supplying the brain. So this rupture of the blood vessel, if the blood is seeping into the brain parenchyma, that is what we call as intraparenchymal hemorrhage. And sometimes the seepage of the blood can also occur into the coverings of the brain, what we call as subrecurrent hemorrhage. So this is what basically is stroke and the types of the stroke.
That looks like quite a heavy definition. And we have Dr. Naman and Dr. Neeraj with us who are further going to simplify it. So I have one quick question for Dr. Neeraj here. A lot of people feel stroke heart attack है. किसी को हार्ट अटैक आता है तो लोग बहुत कॉमनली बोल देते हैं पता है उसे स्ट्रोक आया है. So Dr. Neeraj, is stroke and heart attack the same?
Actually, this was the same problem I faced yesterday with my own family members. And I was telling them that I am presenting something on stroke. I am a panelist on stroke. So they say, what are you doing? You are a neurosurgeon. So why you are going for a heart problem? So stroke is not completely related to heart. Okay, stroke means there is a lack of blood supply. यानी एक ऑर्गन है बॉडी में जहाँ पे अपना ब्लड सप्लाई कम हो गया है, उसकी वजह से वो फंक्शन करना कम कर दिया है. तो वो हार्ट भी हो सकता है, ब्रेन भी हो सकता है. But if we say stroke today, what we are discussing today is strictly related to brain. Brain में blood supply कम होने की वजह से brain काम करना कम कर देता है. It's not functioning well. And similar to heart, if it stops functions, the life stops functioning. So stroke strictly related to heart.
Life stops functioning. My God! Now that sounds quite a serious thing here. Dr. Naman Shah, what would you like to add here? And Dr. Neeraj says life stops functioning. Over to you, Dr. Neeraj. Sorry, Dr. Naman.
Hello.
Over to you, Dr. Naman.
Yes.
Yeah.
Rightly said, when the brain circulation to the... There is a voice breaking, but I can hear. I got the question. Yes, as rightly said by Dr. Neeraj and Dr. Prashant, so the when the circulation to the brain stops, so that part of the brain totally stops functioning. So in that case, the neurons in that particular area die. So every minute there are lakhs of neurons which die, and that is the reason why after stroke every minute counts. So every minute around 10 lakh neurons die, and once they die, they do not regenerate, they do not come back.
Once they die, they never come back, they do not regenerate. A lot of things clearly is visible that, and clearly I can see that there is definitely a lot of confusion about stroke का confusion not just general public में है. I think जिस तरह से लोग बहुत casually heart में थोड़ा सा pain हुआ नहीं कि लोग बोलते हैं शायद मुझे ऐसा लग रहा है शायद stroke होगा. In fact, stroke is something which is usually not much talked about, and that is one of the reasons why Transformative today is doing this panel discussion with such a power-packed panelist, with from neurosurgeons to neurologists. We have a panel today. I have already started getting questions from our readers. They are already sending questions to us. Before we start taking those questions, I have this question to each one of you. Dr. Prashant, why do we need to create awareness around stroke? Why is it important? And why do we have a day dedicated to why do we say that today is World Stroke Day? Why? What exactly is the relevance? Why do we need to talk about it? I think, Dr. Prashant, can you hear me?
Yeah, there was some interruption in between. Now I can hear you. Yeah.
Okay, so we lost your you lost your internet connection somewhere. Not an issue. So I was asking why exactly. What is the relevance of World Stroke Day?
So the relevance of World Stroke Day is basically to increase the awareness regarding this dreaded illness. See, if you look at the number of patients who are suffering from stroke, I was just going through some statistics. Roughly
Right.
about 15 million people annually suffer from stroke. Of these, one third they die, and one third are permanently disabled. If you look at the statistics, global health statistics, stroke is the leading cause of disability as well as mortality worldwide. And out of every 10
Okay.
cases of stroke occurring worldwide, at least one case occurs in India. So you can imagine the number of people who are suffering from stroke. In addition to
Right.
that, up to 80% of strokes are preventable. And even when a patient suffers from stroke, with improvement in the treatment modalities, there are sufficient treatments available to sort of reverse the deficit whenever a patient presents within the specified period of time, or to minimize the deficit. So it is
Right.
important, very important, to increase the awareness regarding this dreaded illness, which is not only preventable but also very well treatable.
As Dr. Prashant is saying, is very much preventable. Now, I have a question to Dr. Naman. When you get patients or when people who suffer from stroke, who come to visit the doctor during emergency, so during that time, is it like something preventable, or you feel that the symptoms were already there, but the patients actually delayed? Over to you, Dr. Naman.
Yes. So rightly said, when the patient, the identification of symptoms in cases of stroke is very important. So we have a acronym which we call it as a B fast. So B is for balance of the body. So chal tak balance chale jana. Then E is for eyes. So eyes problem, for example, दिखने में तकलीफ होना, दो दिखाई देना या बिल्कुल ना दिखाई देना. F for facial droop. So एक बाजू का face weakness आना, तो there is a facial droop. A is for arms or legs weakness. S is for speech difficulty, बात करने में तकलीफ होना. So at such
Right.
times, you have to timely inform and reach the hospital. And reaching the hospital in the stipulated time, that is the window of 3 to 4.5 hours. If the patient comes to the emergency, so we do the imaging of the brain. So एक स्कैन किया
Mhm.
जाता है, एंड स्कैन में जैसे डॉक्टर प्रशांत ने बताया, there are two types of stroke. One stroke where there is a blockage of the vessel, so the circulation stops completely to the part of that brain, and other is a brain hemorrhage. So दोनों की
Right.
ट्रीटमेंट बिल्कुल अलग रहती है. Whenever there is a blockage of the brain, which we understand on the scan, which is done when the patient comes to the ER, So we give injection which is called as a thrombolysing agent. With that, जो भी block होता है, we open that block using those injections. And now with the advancement of techniques, we also have the angioplasties which can be done to open the block in case अगर सिर्फ injection से काम नहीं चल रहा है. So we can mechanically open the block inside the brain as well as if there is any block in the neck vessels or outside the brain. So this is what is we want to tell our audience that identification of a stroke using the acronym of Be Fast is very important. See, heart attack patients, we all know, many of our audience know that चेस्ट पेन होना या लेफ्ट साइड के साइड में छाती में दर्द होना इज ए सिम्टम ऑफ हार्ट अटैक बट ब्रेन अटैक या स्ट्रोक इसके सिम्टम्स बहुत वैरिड है सो आइडेंटिफिकेशन बिकम्स डिफिकल्ट बट आई वांट टू टेल एवरीवन दैट इट इज नॉट दैट डिफिकल्ट follow the simple rule of be fast identify the stroke in the golden period come to the emergency department and we can treat the stroke.
Identifying the stroke in the golden period. Now, I think that is the key mantra to figure out what is happening to your near and dear member of the family or to the near and dear around. Now, the question is how to identify what are the symptoms. You know, for a doctor, it is easy to say identify, but for our viewers and for our readers who are watching the panel live today, I'm sure they have this question in their mind, what are the symptoms? So, Dr. Neeraj, kindly guide us, kindly share some insights on what are the key symptoms which a family should start noticing. What are those things that a family should be noticing? Over to you, Dr. Neeraj.
Thing is that you cannot ignore anything, especially when you are talking about brain. So time is brain. This is the dictum we should follow. Time is brain. The more time you spend, the more brain you are spending after stroke. So common things, even simple headache can be a sign or a symptom of a stroke, impending stroke. So there is a term called impending stroke. Stroke होने वाला है या स्ट्रोक हो चुका है. तो इसके लिए सिंपल हेडेक भी एक होता है, आंखों से धुंधला दिखना. पेशेंट बोल रहा है यार अचानक से 1 मिनट के लिए आंखों से धुंधला दिखा, यानी कोई प्लॉट वहाँ पे जाके फंसा और वो डिसलॉज हो गया. तो यानी ऐसा स्ट्रोक का चांस उसको आगे भी है, तो इसको कभी लाइटली नहीं लेना है. स्लाइट ब्लरिंग ऑफ विजन, उसके बाद में बोलने में दिक्कत, थोड़ा सा चलने में दिक्कत हुआ, बोलने में दिक्कत हुआ उसको, और उसके बाद में उसने कहा ठीक है 1 मिनट के लिए हुआ था, वापस मैं ठीक हो गया, कुछ नहीं करना. ये सब चीजें कभी इग्नोर नहीं करनी चाहिए. कोई भी चीज जब भी आपको ऐसी प्रॉब्लम आती है तो इमीडिएटली यू शुड विजिट अ डॉक्टर. ठीक है, नेगेटिव इम्पैक्ट इट्स गुड कि नेगेटिव हो गया है, कुछ नहीं है स्ट्रोक का, लेकिन अगर पॉजिटिव है यू कैन बी सेविंग योर लाइफ फॉर अ वेरी वेरी लॉन्ग टाइम.
You will be saving the life for a very, very long time. Now, that's quite an insightful information wherein Dr. Neeraj is saying that even the slightest headache or the slightest symptoms, blurry eyes or blurry vision should not be taken lightly. Dr. Prashant, would you like to add something here? Dr. Prashant, can you hear me? Would you like to add something here when Dr. Neeraj is saying that even
Sorry, can you repeat your question, Dr. Supriya? Yes, I can hear you now.
Yeah, so I'm saying that even the slightest symptoms should not be taken lightly. So what would you like to add here, Dr. Prashant?
Hello?
There is, Dr. Prashant, can you hear me?
Yes, I can hear you clearly now.
So my question is very simple. I'm asking that what would you like to add here when Dr. Neeraj is saying that even the slightest symptoms should be taken seriously? What are the, as a doctor, what kind of patients you experience in terms of stroke? I think there is some network.
So I would like to reiterate what Dr. Naman highlighted. This simple acronym, we have to increase the awareness among general public regarding this simple acronym which Dr. Naman highlighted, Be Fast. So anyone who presents with sudden imbalance with walking, B for balance, यानी कि अचानक से चलने में लड़खड़ाहट होना. E is for eye. So anyone who is complaining of sudden onset visual impairment, दो दिखना, अचानक से vision चले जाना. Third, which he highlighted was F. If there is any facial drooping, अचानक से चेहरे में टेढ़ापन आ जाना. A is for arm or leg weakness. अचानक से हाथ की कमजोरी आ जाना. Somebody is losing his grip on object suddenly. The
Right.
other thing was speech, as for speech. So if there's any slurring of the speech, बोलने में लड़खड़ाहट होना, so anyone who's presenting with sudden onset of these symptoms, one should always suspect stroke, and they should be immediately rushed to a stroke ready hospital. That is the key.
Okay, that is the key. That's quite an interesting highlight here. I already have questions started coming in. A couple of questions we are going to take here. Uh, there is a question coming in from one of our readers who is asking, why do stroke survivors go in depression after stroke, and how to deal with that as a family? So a lot of times, now that's quite an interesting one, because a lot of times it happens that the stroke survivor actually, now the question is right there on your screen, so the stroke survivor actually goes in depression, and how to deal with it as a family. Over to you, Dr. Naman. Kindly help this reader here. What can counseling do to such patients?
Yes, the question is very important because there is a lot of propensity for occurrence of depression after stroke recovery, and the main reason for the same is, you know, the neurotransmitters in the brain, the imbalance occurs in the neurotransmitters, and because of which there is a lot of neuronal circuit which go haywire. This is the main reason, biological reason. And other than that, stroke is a major cause of disability. So because of this disability, the patient in his productive life has to be bedridden, which is also a major cause for depression. And to tackle with this depression, counseling is the key factor, support from the family, as well as if required, if the depression is not manageable, we can take medical therapy also for the depression.
We have another interesting question coming in for Dr. Neeraj, wherein the patient, it's not a patient, of course, it's a reader here. The reader is asking Dr. Neeraj, how long does it take to recover from a stroke? Dr. Neeraj, over to you.
So, what kind of recovery are we talking actually? So, stroke is usually, if it has a set in, it's a irreversible process. Once damage cannot be recovered. So, what patient can recover is economically, socially, emotionally, and financially. So, that can be recovery that can be possible after stroke if it's coming after the golden hours. That means we were not able to retrieve the clot, or we were not able to save the part of the brain, and further damage could not be saved. But if the patient is coming in the golden hours, what I said, time is brain, so 100% recovery is possible. So that's, I think, should be the motto for the stroke day this year, that as early as possible, the patient should visit the nearest doctor or the nearest tertiary level, so that there is a 100% recovery chance also. If the stroke has not set up to a irreversible level, that stroke can be prevented, that can be controlled. But once it has set in, it has damaged a part of the brain, we don't know what will happen. It will be impossible to say what will be the recovery, but you cannot recover the patient 100%. Then he will need some kind of rehabilitation procedures, physiotherapy, and emotional and social counseling to be done for the patients.
So I can clearly see all our panelists are definitely on the same page that emotional and social counseling is the key to something which is damaging your brain. So readers and viewers, keep sending in your questions. We have one interesting question coming in for Dr. Prashant. The question is quite interesting. Okay, there are two questions actually. One, the patient is asking, the reader is asking, what kind of tentative cost should we be expecting for stroke treatment? And is stroke hereditary? Dr. Prashant, the question is, what kind of tentative
Can you
cost
just
should
please
we be
repeat? Yeah,
expecting?
just please repeat.
I'll simply, you know what I'll do? I'll simply be highlighting the question right on the screen for you to read. What is the tentative cost of
Yes,
stroke
yeah.
treatment? Yeah.
Okay. So, see, treatment would depend upon the underlying cause of the stroke also, what kind of stroke the person is having, whether it is a hemorrhagic stroke, which we highlighted earlier, or if it is an ischemic stroke, and how bad the stroke is, what is the deficit patient had. So, it will all depend on a mixture of all these. So, suppose like Dr. Naman and Dr. Neeraj highlighted, if somebody is suffering from a stroke which is related to blockage of the blood vessel that is due to a clot formation, and he or she reaches within the golden period, and he or she is a candidate for what we call as clot busting medication or thrombolytic therapy, uh,
Right.
that medication costs roughly around 55 to 70,000 depending on the weight of the patient. So the medication dosage is based on the weight of the patient. And if somebody is a candidate for surgical removal of the clot, then it becomes an expensive procedure, which may cost somewhere around 5 to 7 lakhs, depending on the complexity and other factors.
We have an interesting question coming in, Dr. Naman, if you would like to answer. How can we reduce the chances of stroke? I think that's what she's trying to say here. How can we reduce
Yes.
the chances of stroke?
That's a good question. So, stroke is more preventable than treatable. So, it can be prevented by keeping in check a few things. So, blood pressure is one of the things which needs to be kept in check to avoid stroke. So, I would like to tell the audience that you should get your blood pressure checked at least once in 3 months so that you can avoid an impending stroke. Then to check your diabetes, to get a screening of diabetes every annually or every 6 monthly. If you have a family history of diabetes particularly, then you will need to get it checked more frequently. Then cholesterol, reduce your cholesterol by eating healthy food, having more of fiber in your diet, reducing your oil and other fatty foods. Another lifestyle change which is really required is smoking and alcohol is one of the major contributing risk factor in any kind of stroke, or for the matter of fact even it causes heart attack as well. So smoking, total cessation of smoking, alcohol and any addictive substances is one of the things which is required as a lifestyle modification to avoid stroke. And regular physical exercises, at least 45 minutes of exercises daily is mandatory to avoid stroke.
So I think you have fairly answered this the next question, which was coming in by one of our readers, that are there any lifestyle related factors that increase the risk of having a stroke? So I think Dr. Naman has already briefed, and I assume that the reader is quite satisfied with the answer. Before we start taking questions further with our readers, I have this quick question to each one of you. When it comes to stroke, as a doctor, I'm sure you experience a lot of myths which are already, which are underlying in the society. So, as doctors, आप every doctor, I'm asking each one of you, आप एक कौन सा myth है जो आज आप readers के सामने उसका fact बताना चाहेंगे? It could be something hilarious, it could be anything, because readers, as reader, I'm also a reader. Till yesterday, even I was thinking शायद stroke ही heart attack है. पर आज हमें भी ये पता चल रहा है कि नहीं, it is brain attack, it is not heart attack. So over to Dr. Neeraj Sharma. Any particular myth that you would like to mention?
I think for stroke, myths will be more be answered by neurologists. So regarding surgery, I can say that no food, no food will cause stroke, or no food will worsen your condition after any stroke surgery which have been done by a neurosurgeon. You can eat anything. There is no such thing कि खट्टा खाने से मुझे स्ट्रोक हो सकता है या नॉन वेज खाने से मुझे स्ट्रोक हो सकता है.
Okay, that's quite an interesting and hilarious myth here. I never knew that. Okay, readers also think कि खट्टा खाने से या कुछ नमकीन खाने से stroke हो सकता है. But
Actually,
yes,
it's
I
so
think,
common कि every second patient is asking me the same thing.
okay, so this myth is so common. I'm sure Dr. Prashant and Dr. Naman have quite an interesting add-ons here. So over to Dr. Prashant.
So we encounter multiple such myths regarding stroke as against any other neurological illnesses. Like one common myth is stroke is an act of God. ये सब भगवान की देन है. So I
Okay.
would like to highlight that stroke is like any other neurological illnesses. It is both preventable, provided we follow a good, active, healthy lifestyle and continue to take the measures which Dr. Naman already highlighted. And in case somebody unfortunately suffers from stroke, it is very well treatable, provided you have to reach the hospital timely and take appropriate treatment as advised by the neurologist. Another important myth which we commonly encounter is stroke occurs only in elderly individuals. That again is very wrong. So although it is very common in elderly age group, but stroke can happen from childhood to any age group. Though the causes may be different, the underlying cause may be different, but stroke can happen even in a neonate, in a middle-aged individuals, and of course in elderly individuals.
Yeah, we actually have a question coming in, but before I take that question, over to you, Dr. Naman. Any particular myth that you would like to talk about, or something that you have experienced in your as a doctor?
Yeah, so during my training years back in Karnataka, so there have been a lot of local quacks who have been treating the paralysis or the stroke issues. So I want to tell the readers that, stroke, whenever a patient suffers from stroke, do not rush to any quack who treats stroke without even imaging done, because, there are different type of strokes, the treatment differs, and people usually tend to go towards this quack, and they treat, and then the stroke worsens, and then it becomes a problem when they come to us. So whenever you have symptoms of stroke, come to the right doctor, come to the emergency, get a scanning done. Without scanning, do not take any kind of treatment. And as rightly highlighted by Dr. Prashant, the stroke is very well treatable now. सो ऐसा नहीं है कि एक बार पैरालिसिस हो गया तो उसका कोई इलाज नहीं है. You come in the window period, the golden hour, and you can walk home by yourself.
I can clearly see the golden period is, each one of you is talking about that golden phase, that golden period. A similar question is coming in. In fact, I'll just show it to you. So, can a stroke cause paralysis? Now, I know that's a common, doubt, a common question. In fact, I have literally seen families going in panic. Just because there is stroke, and the first thing that comes to their mind is either the person, the near and dear one, will go in coma or will experience paralysis. So over to Dr. Neeraj Sharma, who happens to be a neurosurgeon. So can you please tell us more about it?
Yeah, the question says that yes, stroke can cause paralysis. Actually, brain has different parts controlling different functions of the body. So, which part of the brain is affected? So, you will see that part is affected. So, if that speaking center is affected, you will have difficulty speaking or you will have loss of speech. If your motor control segment is affected of the brain, that will cause paralysis definitely. But that is not only it. You can have only face paralysis, you can have only आर्म पैरालिसिस, सिर्फ पैर का पैरालिसिस हो सकता है, सिर्फ पैर का हो सकता है, सिर्फ फेस में ट्विचिंग आ सकती है जो आपको मालूम भी नहीं चल रही है. आपकी किसी फैमिली अटेंडर ने आपको देखा कि हाँ आपके फेस में कुछ एसिमेट्री आई है, बोलने में दिक्कत आई, आपको लगा कि हाँ तो जबान सूख गया है. ये भी एक कॉमन मैंने देखा है कि 3 दिन पहले ऐसा कुछ हुआ था, उनको लगा कि जबान सूख गया है, उन्हें बोलने में दिक्कत आई. बट दैट वाज व्हाट वी से अ सेंटिनल इवेंट था कि ऐसा कोई स्ट्रोक का उनको चांस हो सकता है. तो ओनली पैरालिसिस नहीं, स्ट्रोक में बहुत सारी चीज़ें हो सकती है, लेकिन हाँ पैरालिसिस इज़ वन ऑफ द कॉमन फाइंडिंग जिससे इंडियन पॉपुलेशन डरती है, और जब वो होता है तभी वो लेके आती है, वरना कॉमनली दे विल वेट या फिर आसपास के लोकल डॉक्टर को लोकल मेडिसिन स्टार्ट करने को बोलती है. तो एक बार जब पैरालिसिस
Which is clearly, yeah, which is, I can clearly see Dr. Naman and Dr. Neeraj are definitely talking about the same thing, that immediately you need to rush to a reliable hospital and a reliable doctor or a surgeon. I have one quick question coming in. I think, Dr. Prashant, if you would like to take this question, quite an interesting one. Even I would like to know about it. Can your brain repair itself? Like after stroke, क्या brain में इतनी ताकत है कि वो self repair mode पे जा सकता है? Dr. Prashant, over to you.
So yes,
Doctor. We are losing him, I guess. There is some network issue at Dr. Prashant's end. Dr. Prashant, can you hear me? Dr. Naman, would you like to take this question?
Am I audible, Dr. Supriya?
Yeah, you are audible now.
Yeah, am I audible, Dr. Supriya?
Yes.
Yeah, so see, that is actually an interesting question, which we have highlighted.
There is some network issue. Please, Dr. Naman, over to you. Can you please take this question?
Sorry, can you repeat the question? There was a network problem. I didn't get the question.
So we have quite an interesting question coming in. Can the brain repair itself? The reader is asking, क्या brain self repair mode पे जा सकता है?
Yes, it's a quite interesting question. So, as already been mentioned earlier, when the circulation to the brain stops and the patient comes to us with the stroke in the window period, when the at that window golden period, the brain tissue or the neurons are still salvageable. We can protect the brain in the window period, but once the damage is done, then we cannot do anything. It unlike liver or other organs, the neurons do not regenerate usually. So that's the reason why time is brain. Every minute counts. The motto for today's World Stroke Day.
We, Dr. Prashant, can you hear me?
Yes, I can hear you. I think there was some
Okay,
interruption
there
in
is some
between. I
network
lost
issue
the
with
connection.
Dr. Prashant. I have a couple of quick
Now I
questions
can hear.
coming in. If someone has an immediate stroke and there is no medical facility available, okay, let me just highlight it on your screens because this is quite an interesting one, especially during the pandemic time. We are going through a pandemic period and we have been witnessing lockdown. So this is quite an interesting question, actually, that if someone has an immediate stroke and there is no medical facility available, what is the first thing? Of course, that's one good question. I mean, even I would like to know, as a family, what is one thing that I'm expected or I'm supposed to do? Dr. Neeraj Sharma, over to you.
Uh, First of all, actually, a general population cannot say whether the patient is having a stroke or not. Okay, patient is aware it might be a stroke. You cannot help at home. You should be shifted to a nearest tertiary level hospital where at least a neurologist or the intervention radiologist or a neurosurgeon should be available. At least a medicine fellow should be there who is at least capable of starting the primary medication in case it's a stroke. But for home remedy, I think there is nothing available. You have to immediately shift the patient to a nearest tertiary center.
So there is, as such, there is no home remedy, dear readers who are watching the live today. We have quite an interesting discussion going on World Stroke Day. Stroke को इतना lightly मत लीजिए. Stroke काफी serious है. घर पे घर के नुक्स आप अपने DIYs मत कीजिए. That is a clear indication which I can see all the doctors are highlighting. We'll be taking one quick question here. Before we start talking about the challenges and other things about stroke, I have this question for Dr. Prashant. I hope, Dr. Prashant, you can hear me now. Uh,
Yes, yes, I
so
can
I'm
hear you.
highlighting the question here. Again, quite an interesting question. Is it true why are diabetics more likely to have stroke?
So actually, that is a true fact that diabetics are at increased risk of stroke, mainly because, like in hypertensive patient, those who already have cardiac disease, similarly in patient with diabetes, the blood vessels which supply the brain, they become thickened and they are more liable to be ruptured also.
Okay. There is clearly a network issue at Dr. Prashant's end. Dr. Prashant, we are losing you.
Now,
We have
was I? Yes,
can't
was I?
hear Dr. Prashant. Dr. Naman, would you like to take this question, please?
Yes.
Is
Okay.
So
Now can you?
diabetes one of the is a diabetic patient? Yeah, please go ahead.
yes. So as rightly said, diabetes is one of the major risk factors for stroke. So what happens in diabetic patients? The blood vessels of the brain get thickened, and the cholesterol gets integrated into the blood vessels. So slowly the diameter of the blood vessel narrows, and at one point it totally creates a blockage, which disrupts the blood flow to the brain, and that is why diabetes are at a higher risk of developing stroke.
क्रेजी लाइफस्टाइल के बारे में काफ़ी रीडर्स हमारे यहाँ बात कर रहे हैं, कमेंट्स आ रहे हैं, इनफैक्ट मैसेजेस भी आ रहे हैं। आज के टाइम में इट इज़ नॉट जस्ट क्रेजी लाइफस्टाइल, इट इज़ नॉट जस्ट हेक्टिक लाइफस्टाइल, it also happens to be a stressful lifestyle, especially with pandemic. We have clearly seen people losing jobs, depression is right around, mental illness is right there. So during such times and during such, when your mind, when your brain is going through such ups and downs, when your mood is going through such ups and downs, can this actually trigger, if not, maybe you were not expecting a stroke, maybe you were absolutely healthy, you look healthy, क्या ये stroke trigger कर सकता है? Dr. Prashant, can you hear me? Can you hear me now?
Yeah. Yes, I can.
Yeah.
I can hear you. I got your question also. So, see, stress in general is not good for health. Stress leads to increase in blood sugar levels. Stress can also lead to increase in level of certain hormones, what we call as glucocorticoids and catecholamines. And these hormones can again lead to fluctuations in blood pressure as well as sugar levels. And so indirectly, it can increase the risk of developing stroke. That is how stroke increases our chances of developing stroke.
So not directly, but somewhere indirectly, we can see this. Um, There is one more question here coming in about hospitals. Yeah, in fact, a lot of readers are asking this question that, every hospital has a different price point when it comes to treatments. And some of the readers I can clearly see have questions for the hospitals. Ki, I would like to know this as well, that while taking them to the hospital, this is a question coming in from one of our readers. जब hospital patient को ले जा रहे हैं, जिसे stroke आया है, जिसे brain attack आया है, पेशेंट किस पोजीशन में होना चाहिए? नाउ दैट्स क्वाइट एन इंटरेस्टिंग वन। क्या उसको सिटिंग पोजीशन में रखना चाहिए या क्या उसे लिटाकर स्ट्रेचर पे ले जाना चाहिए? नाउ दैट्स अ गुड क्वेश्चन बिकॉज it is everything is to do with the blood flow. Somewhere it is either clotting or I think that's exactly what the reader is trying to ask. Dr. Naman and Dr. Prashant, over to both of you. So Dr. Naman, can you just tell me more about it?
Okay.
I'll just highlight this question on the screens. Yeah.
Yeah. So basically, the patient, if has presented with weakness of one side, paralysis है, so it is better to be shifted the patient in supine position rather than sitting position. So that's the best way you can shift the patient so that you can avoid any kind of injury.
That's the best way to avoid any kind of injury. Clearly, Dr. Naman has briefed it in one simple line, but I think the readers are still not clear. When you say supine position, what exactly is that? Dr. Prashant, can you please elaborate further on it?
So supine position means lying down position. Yeah. So supine position means lying down position. The other things also which we should highlight is many of the patients with stroke, they are drowsy. They cannot swallow properly, and sometimes we see many of the relatives or family member, they would put something like water, some drops of water, or they would like to give some tablets to the patient. That should never be done, because when a patient is drowsy, he or she has developed weakness of one side of the body. Similarly, their swallowing is affected. They are not able to swallow properly. So in such case, if we insert something, give some drops of water or some tablet, and if they are not able to swallow properly, it can go into the air pipe, which can affect the respiration, and it can be sort of detrimental to their life also. So that should never be done. Another thing, when sometime a stroke and a convulsion or a fit occurs together. So in such cases, in addition to making the patient supine, as Dr. Naman said, that is lying flat with on his back, we should also make the patient turn to one side, because if they are having frothing from the mouth, there are excesses of salivation that again can go into the air pipe, which can lead to choking and aspiration. So make the patient lie down flat, and in case there is excessive salivation, make them lie down laterally also to one side,
काफी
either to the left or the right.
यहाँ पर हो रहा है. Dr. Prashant, Dr. Naman, and Dr. Neeraj. Somewhere I think he has lost some network or something, so he is still not joined live with us. one last quick question I'm going to take before we go to both these doctors. एक रीडर ने ये क्वेश्चन पूछा है, क्या कोई फूड पर्टिकुलर है जो ट्रिगर कर सकता है स्ट्रोक या लॉन्ग टाइम तक? ऑफ कोर्स, आई मीन दैट्स वन गुड क्वेश्चन. In fact, I would definitely like to know, because in today's time we can see the millennials, the youth, everyone is becoming fitness conscious, and in that process of being fitness conscious, they are following some crazy diets, some crazy diet patterns, sometimes some extreme diet patterns as well. So can that also trigger stroke, or can that lead to stroke somewhere in future? Yes, Dr. Naman, would you like to answer this question?
Yeah, having a healthy lifestyle is one thing, but going to an extreme to maintain that healthy lifestyle may not be as useful. So I would avail all the youth and colleagues and friends of mine that, if doing regular exercise itself is sufficient, and don't follow any extreme diet or any external supplements. Try to incorporate all the necessary ingredients in your regular diet, and don't be too overboard regarding your exercises and your diet plans. Basic things are just sufficient.
Sticking to basics, sticking to what your basic routine has been is more than sufficient. That's a clear message we can see here coming from live from our panelist on World Stroke Day. Before I sum this interesting panel discussion which is going on, and the questions on and the comments and the queries are still coming in, I will quickly be going to each one of you. Dr. Prashant Makhija, one quick message for our readers on World Stroke Day.
Recognize stroke, reach hospital in time.
Recognize stroke and reach hospital well in time. That's a quick message which Dr. Prashant has given. I hope by watching this panel and by taking this interesting information, I'm sure by now the readers will be able to figure out how to recognize it. Over to Dr. Naman Shah. One quick message for our readers on World Stroke Day 2020.
Yes. So worldwide, every 1 out of 4 adults have stroke. So my message is, don't be that one to have stroke. Prevent the stroke before it occurs to you.
Don't be that one to have stroke, and prevent before it occurs to you. That's quite a positive and inspiring message. Transformative today readers and viewers who are watching us live. We still have questions coming in, but because of the shortage of time, and I can clearly see you all are busy today with your back-to-back lives and panels. Thank you, Dr. Prashant Makhija. Thank you, Dr. Naman Shah. And thank you, Dr. Neeraj Sharma, who is not live with us right now, for sharing such valuable information with transformative readers. Stay tuned, transformative readers. We will be bringing in more such live discussions, and keep sending your questions. The doctors are with us and they will be answering the questions on the comment box, which will be shared with the doctors later on. Thank you so much once again. Have a wonderful evening. Thank you, Dr. Prashant, Dr. Naman. Bye-bye.
Thank you.
Thank you.